Who let the dentures out, folks? Who, let the dentures out. Denture care today and some things to keep in mind. And many of your clients will have their own dentures. However, there's different types and variations, right? You can have a top denture, you can have a bottom denture, you can have a partial denture, spaces for their real teeth as well as artificial teeth, right? So many different variations of dentures you will be looking after and performing hygiene for. So things you should keep in mind is how to handle them, how to wash them. You may be asked to take them out of your resident's mouth. First of all, if they can do it on their own, obviously you get them to do it on their own. You put it in a denture cup, take it to their washroom. If not, you're going to have to gently pull it out of your client's mouth. Good tip is get a piece of gauze, a square piece of gauze, the little cloth we use for dressings. And that gives you a nice, good grip when you hold it in your fingers to take it out. Some PSWs like to go over the side of the mouth of their clients, wear a glove, go over to the side and push down a little bit with your finger because sometimes the dentures are stuck on very well. And sometimes PSWs forget, right? They forget to take them out. The next night, they're stuck on even more for the next PSW. So when we put our client to bed, we're going to take their dentures out that way, take them to the sink in the washroom, put a towel in the bottom of the sink, please. You do not want to chip or break your resident's dentures. They're very expensive. So towel on the bottom, and then we're looking for warm water. We never ever use hot water to clean our clients' dentures. They bend or what we call warping. We don't want to warp our clients' dentures. It won't fit in their mouth properly. So always we're using warm water and soap to clean the dentures, unless they give you a recommended denture cleaner. And then we're going to put them in the little blue or white denture cups. I'm sure you've all seen the plastic cups the dentures go in with a nice lid to close down overnight. We usually fill them with water and put a little polydent puck. I call them polydent pucks. They go into the denture cup and they dissolve, clean the dentures throughout the night as well. If you're working the morning shift, then it's going to be reverse. You take the dentures out, you wash and clean them, and then you take them over gently to your resident. If they can put them in their mouth, they're going to do it. If not, you can assist them in putting them in your client's mouth. Okay, so the other thing to keep in mind is also oral hygiene or oral care that we're going to do for our resident as well. So for this, the dentures would be out of their mouth, and then we're going to take the little swabby sticks. Everybody has seen the little swabby sticks with the sponge on the end, and we're going to gently clean around the inside of our client's mouth, on the inside of their cheeks, the gum area as well. Oral hygiene, very important because your client is eating and carrying bacteria in their mouth constantly. They swallow that bacteria. That bacteria goes into their circulation and can actually cause severe things like stroke, heart attack, clogging up arteries. That type of thing can occur with poor oral hygiene. So we want to make sure we're providing good oral hygiene to our clients. They are giving you different reasons here that your client may need oral hygiene. If they smoke, oxygen. Anxiety is tricky. Anxiety causes them maybe to swallow more saliva, so the mouth area is much more drier. And any type of decreased fluid intake will affect the dryness of their mouth as well. And I think number one are the medications, right? So many medications can cause dry mouth symptoms in your resident. So we're providing excellent oral hygiene, excellent denture care, and then you're going to know you're looking after your client excellently. Thanks for watching. See you next time on Caregiving Joe Show. Remember to like, share, subscribe.